In every evaluation, it is important to assess the participant's range of motion. This will show the evaluator a participant's abilities as well as limitations, so they are able to prescribe appropriate exercises. Additionally, knowing the participant's range of motion will help the evaluator determine potential gains of the participant by exposing strengths, weaknesses, and imbalances. When assessing one's range of motion, it is important to record the results in the most objective way possible, so other fitness professionals are aware of the participant's capabilities. One way to record the measurements is to mark the participant's joint range of motion in degrees.
So with your arm at your side straight, you're going to lift it up towards your ear.
In this case, the evaluator would mark the individual was able to actively abduct their shoulder the full 180 degrees. There are two types of movements the participant can engage in, and these are active and passive movements. Active movements are those in which the participant can do on their own, and passive movements are those in which the participant cannot do on their own, so the evaluator puts the joint through the range of motion for them.
For this, I want you to kick your leg out and extend that knee.
As you can see, the participant performed the movement with full range of motion. The evaluator will mark on their sheet that they were actively able to perform the movement with full range of motion, resulting in the joint being at 0 degree at the end. Muscle weakness, cognitive deficiencies, or difficulty understanding the task, and contractures are examples as to why a participant may not perform the active range of motion and may need assistance. It is important to write exercise prescriptions that utilize the participant's full capabilities. If the issue is muscle weakness, but the participant has full passive range of motion, there may be exercises he or she can perform to help increase their range of motion.
For this, we're going to do shoulder flexion, so starting with your hand at your lap, we're going to come up, elbow straight, as far as you can. Good. May I go through the passive range of motion?
Yeah.
It is important to note when performing a passive range of motion assessment that the evaluator should not stretch the body part past the point of discomfort. For example, if the participant has a contracture of the elbow, it is not necessary to fully extend the arm. Simply make a note on the evaluation sheet that the participant will have limited function with that arm. Please note, the special precautions must be made if the individual has poor or no sensation in the affected limb or side of the body. If the individual has a lack of sensation, there is a risk of overstretching the muscle. In this case, the individual should get stretched by trained personnel, such as a physical or occupational therapist, or the trainer should get trained by the professional on the proper stretching techniques for the individual. Some individuals with physical disabilities develop contractures, which are shortened muscle groups and connective tissues surrounding the joint. The muscle tone is very high, which is referred to as hypertonicity. A contracture occurs when a body part, either the arm or leg, is placed in a flexed position over an extended period of time, usually resulting from spasticity. Sometimes this can be prevented by constantly stretching the muscle group, while other times it cannot be avoided due to neurological involvement. Contractures may be permanent or temporary, depending on the severity and spasticity, and the length of time the joint has been placed in a fixed position. The fitness instructor should consult with a physical therapist or a qualified health professional to determine if contractures can be strengthened. Flexibility training should always be integrated in the exercise prescription for people who have contractures, since the primary problem is shortening of muscle fibers and connective tissues surrounding the joint.